When we talk about endodontics, we're going to talk about everything that's inside the tooth. So it's your lymphatics, your nervous tissues, and also your pulpar tissue that's producing dentin. So the normal function of the endodontic system is to continue to lay down dentin inside that tooth so that as it's being worn away, we can rebuild it and keep a level of secondary dentin in the occlusal surface.
Mhm.
So each maxillary tooth has 5 pulp horns on it, unless we're talking about the 6 that has a 6, and the 11 that has a 7 and an 8, and the lower teeth, or in the maxillary teeth also have 2 infundibula. The mandibular teeth have 5 pulp horns on them, except for the 6 that has a 6 and the 11 that has a 7. And in your examination with your mirror, this is take home tip number 1 right here, is that you need to look at every pulp horn in that horse's mouth and every infundibula. And if you're not providing a full oral exam. So if I visit your practice and your mirror is not all scratched up, I know you're not using it. And it's very important to utilize that mirror for looking at all these little things. And what we're really training your eye to see is a difference in color a lot of times, because the pulp horns should have a nice kind of brownish stain to them, but the primary dentin that surrounds that portion of the secondary should be a pretty creamy white color. And if we're starting to notice a dull kind of brownish color of a pulp horn, or there's some food stuck to the tooth that we can't rinse off easily, and you even rub it with something and it doesn't come off, you probably have a pulp horn exposure. So getting in there with your little occlusal surface probe, which is a delicate instrument, and it's made to basically examine the surface of that to feel if you can catch. It should slide nice and freely like you're scratching glass with it. But if you fall into one of those pulp horns, you more than likely have an exposure that requires imaging to prove whether that tooth has significant endodontic disease or not.
Mhm.
Because the teeth are continually narrowing their chambers as they get older. They're continually laying down dentin. And we're trying to pick up a defect on the occlusal surface with our mirror and our pick to realize if that's happening or not. When we talk about examining the infundibular structures, that's a dead structure in the middle of a tooth. We think it's there to provide an extra width to the maxillary tooth for a grinding situation, but those generally are some type of anatomical defect that's an acquired thing in the tooth where cementum has not entirely filled that infundibula and allowing food to impact, and then the whole decay process with acid fermentation to happen. It's been said in the literature that only 11% of the infundibula in horses are really normal. So you're going to find a lot of infundibular changes, but the ones that are significant are probably the infundibulae that are coalescing together, weakening the center of the tooth, leading to some type of fracture.
Of course. So perhaps we should go through the grading or the staging of infundibular caries.
Sure. So we kind of said that the first off, a lot of infundibulae are going to have changes. But when we look in a mouth, if we have a nice, I really like to use color in teeth a lot. And if I've got a tooth that's a nice yellow cementum and nice opalescent enamel, that's probably a healthy tooth with a nice dark staining secondary dentin. If we look in the center of that tooth and we see food sticking into a hole of it, but there's just a concentric circle around that food and the rest of the cementum looks pretty normal, that's probably a widened vascular channel that went up through that infundibula during development, and that would be a stage 1.